Dun, 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 dun. Good morning.
Hey, good morning, Matt. How are you?
I am doing awesome at day 3 of the annual enrollment, number 10.
It is indeed. That means we are working our buns off.
Yep, and I kind of sprung one on Suzie today. We're here at the Suzie Health Solutions, the enrollment center located in Wenatchee.
Yep, the enrollment center for the Washington Healthplanfinder. In case
Yes.
you were curious what we're talking about. Welcome to Suzilla.
Welcome to Suzie. And one of the things out there is we it's part of the industry because call centers are a big part of the industry. We have a lot of friends that are customer service reps
Yes.
that do that job.
Yes.
And a bunch of workers who handle the Medicare and Affordable Care plans walked off the job in Louisiana, Mississippi, Kentucky, and Virginia today, demanding better pay and less stressful workloads.
Huh.
The workers are employed by Maximus.
I don't know who Maximus is, but they must not be paying enough.
They're a federal contractor, and they're asking for pay raised to $25 an hour and more breaks between calls. The call center workers answer about 15 calls a day, averaging about a half hour each.
That sounds about right.
On a busy day like today, which is the first day of enrollment, the Affordable Care Act workers said that they can take up to 20 calls.
That sounds about right.
Yeah.
Sorry, gang, but that's what we've been doing.
Yeah, Maximus had an operating income of $408 million in fiscal year 21 and 34,000 global employees.
So are they? They're a contractor. So are they? They must be there must be like call center. Okay, so if we call the Washington Healthplanfinder, we get a call center.
Yes, I do not know if they're involved in this.
I know we've called in the off season. We have been known to call down south before.
Yeah, because it's one of those things. Sometimes we need additional bumps like that. The entire insurance industry relies heavily on call centers.
They do. They absolutely do. And the call center employees are heavily underrated.
Yes.
And the fact that they are pushed so hard to do so much so quickly is why they cut a lot of corners, and you end up with some dirty pool in there.
Yeah, and that's one of the things. It's like, yeah, I feel for the call centers. However, I've always been an advocate for, hey, let's have some boots on the ground.
Yeah, live people like you and me.
And the reason why I advocate always using live people is because if you use the live people in your neighborhoods, congratulations, you get more money in your neighborhoods.
That's true. Now, if you're calling Louisiana, you're putting money in Louisiana's neighborhood. Yes. That's fine for Louisiana, but it doesn't help your local town.
Yeah, and that's really key. I had someone, it was actually early on during the Affordable Care Act. It's like, well, and I mentioned that, hey, $20 a policy, if an agency is helping, $20 a month per person, and agency's helping 1,000 people in, say, Detroit, instantly you've got $20,000 a month. How many people are going to be employed taking care of people in Detroit?
Exactly.
And how many, 1,000 people is not a lot in a big city like that.
No, it really isn't. Which is why they hire big call centers.
Yeah, and however, that keeps the money local.
Yeah, it does. It keeps local to where you're calling. Now, I'm wondering if mostly, because if you're in Washington State, we've got our Washington State Health Exchange. Other states have their own health exchanges. And then if you don't have a health exchange, the state relies on Medicare or sorry, not quite awake yet. Help me out, .gov.
Healthcare.gov.
Healthcare.gov.
Well, you've also got, and this is one of the things that some people don't have a picture of, is the insurance companies themselves also license and contract agents who operate out of call centers.
That's true.
One of our most famous in our state is Molina, because we know they operate out of San Francisco.
Yes.
Out of California.
Yes. I mean, most insurance companies have call centers for their help desks.
Somewhere along the food chain they do. USAA is famously, they got most.
That's all they are. They're all call centers.
Yeah, they're all call centers out of Texas.
Yeah, and when you got like the famous internet.
Geico?
Well, like Geico and some Progressive.
Mm-hmm.
The General is a good example.
Okay.
It's all It's all on the phone. It's all internet. There's very few live boots on the ground.
Yeah.
So now call centers, I don't want to give grief to the people working at the call centers because they're just trying to feed their families.
Oh yeah, absolutely. However, it's just one of the phrases I coined a couple weeks ago when we're talking about is there has been this insane need to cut out the middleman.
Yes.
Because the argument from the 80s and earlier has been is like, if you cut out the middleman, you're going to save.
Yeah.
Well, that's fine and good if you're an expert in the field.
Yes.
If you're not an expert, by cutting out the middleman, sometimes you cut your own throat.
Well, because then you've got frustrated customers who are at the end of you're at the top,
yep.
The customers are at the end, and there's no one in there to answer the questions besides you.
Mm-hmm.
And that doesn't always work so good.
And when you're dealing with financial products, we go to school and we study and we geek out on this stuff on a regular basis.
So we are officially middlemen. I mean, that's why they call us brokers.
Yeah, because our deal is we connect the consumer with the company.
Right.
And here's the goofy thing. We don't work for the company.
No, we don't.
Most companies say we'll have a contract. If we badmouth them, they can fire us at will.
Mm-hmm.
There are times where they have said, "Oh, we're not going to offer commissions anymore. You're gone."
Mm-hmm.
The only one who keeps us employed gainfully is the customer.
Yeah, we're here to help you out. If you don't work with us, we can't get the commission out of the insurance company. Mm-hmm. We don't charge our clients. We charge the insurance companies.
Correct.
They're the ones that have all the money. So why not?
Yeah.
That's what I've been telling my clients. It's like, yeah, well, how do you make your money? Well, we charge the insurance companies. They're the ones that have the money.
Yeah. And that's been a formula that's worked for us for a decade now.
Yeah, we're not now.
Because this is year 10.
Yeah, year 10. And then a little bit of stuff before that, but not this.
Yeah, you might see some, there's always some customer service crunch.
Yes.
We're going to see it, with strikes like this, you're going to see more of that.
Yes. Well, part of what you're running into is it goes back to the Great Resignation, as it were. Well, with the whole COVID thing and a lot of people not being employed and in-person call centers where you have to go to the call center to work rather than working out of home. I suspect that's mostly who's striking. I haven't read the article.
They actually strike at 4 call centers. So,
but I also know that I've called a lot of call centers lately for customer service help, and people have been working from home, and I'm fine. I'm woohoo on that if it makes their lives easier. So that's still happening, but I get why.
You get why
I get why they're wanting more breaks between calls, because if they're doing 30-minute calls, 20 calls a day, you barely got time to pee.
Yeah.
And I know this because I barely got time to pee.
Well, yeah, we are. This is one of the things that is. We are. It's a brutal pace. It really is. We handle. I'm going to bring up what we did yesterday. I think we're at 35 for 2 days.
Oh, people, yeah, something like that.
Well,
appointments.
It's not 35 people. It's 35 families.
Yeah,
because it can be
multiple people.
Yeah,
yeah, and that doesn't count the emails and some of the phone calls we fielded.
No.
But just people we touched with appointments by phone or by video chat or by person.
Yeah.
It was a lot of people, and that's just the first 2 days. It's gonna it's gonna be that busy.
Yeah. We had someone that said, "Hey, I've got a flu. I've got a doctor's appointment. And I saw that my schedule's out. Can I push it back? I might be a half hour late." And it's like, okay, then we need to reschedule. because every half hour on the half hour, a new group is coming in, and we're working with them.
Yeah. It's and if it's Medicare, you get an hour. If it's not, you get a half hour, because we can do that's the way our timing works out.
And yeah, we've been telling people, hey, set your appointment since September.
Yeah, and our appointments are getting booked up. We're booking out surprisingly far in advance. We are able to be flexible to a certain degree if you're willing to be flexible to a certain degree.
Yeah, we're.
I mean, I've got some earlies, I've got some longs. It's just part of the deal.
Yeah, because here's the thing: a call center cannot pay someone 7 days a week because you run into overtime hours.
Well, you can, but you'll be wasting money.
Yeah,
but I bet some of those people are getting overtime.
Oh, I bet they are. But like I said, it cuts into the bottom line.
I bet they're understaffed too.
Oh yeah, I know they're understaffed,
which is why they're getting so many calls.
And there are some, because of the American Rescue Plan and the Inflation Reduction Act. You've got enhanced tax credits again, for another 3 years now. And so you've got these amazing deals on healthcare.
Oh yeah.
So it's like it really pays to shop. Because I tell people, do not accept a plan that rolls over, because that's usually in the insurance company's best interest.
Yeah, if it rolls over, it's not a bad idea to take a look at it.
Yeah,
sometimes it's perfect fit.
Yeah. But yeah, looking at every year, spending at least 5 minutes to say, okay, yeah, does this work, or is there an option out there?
Exactly. Well, I had one that was a rollover, that the plan that was being, that the client was currently enrolled in was being discontinued. They rolled them over to a similar plan.
Yeah.
But about $150 more expensive per month.
Yeah, that's in the industry, it's called cross mapping.
Yeah, and if this client had been struggling with, if they were in the plan they were in for 2022 because of health concerns, which have been resolved.
Nice.
So they were actually able to scale back. And if they just let it roll over, they would have been paying a whole lot more, and it wouldn't have been as usable. So we put them into something that was more usable for them. And
one of the big things in Washington,
and save them overall $300 a month.
Yeah, in Washington State, another thing that has kicked in for they're estimating that 40% of the people on the exchange that are the Healthplanfinder that are using paid plans is Cascade Care Savings.
Oh yeah, and that's been amazing.
And we've seen people who didn't qualify for credits get credits.
Right. We had a client who came in and didn't qualify for federal credits because of weird little things that were going on that we can't really talk about.
Yes.
But they still qualified for the Washington State Cascade Care Credit, because Washington State was a little more flexible in that.
Yeah.
So their premiums significantly changed.
It was like a $600 reduction, if I remember right.
$360, I would say.
$360,
but they weren't paying that much to begin with.
Yeah.
So it was huge.
So yeah, this is really the time to shop. And it is a brutal pace.
It is. So give me some grace.
Yeah, it's one of those ones we're when I say we're working 7 days, we're literally working 7 days a week.
Yeah, I'm here.
It's not sexy. It's not glamorous.
Oh, come on, I'm sexy.
You are, but that's beside the point. But the actual workload.
It's not sexy. It's hard, and it's good. The good news is I really love this.
Yes.
So it's although it's a lot, and I go home and my brain feels like a tapioca pudding. I've helped a lot of people, and I am satisfied with my job. I am enriched by my work.
Yes.
And that's flippin' awesome, because I have gone home feeling the same way, mentally and physically exhausted, but feeling like I just got run through the ringer. I don't feel run through the ringer. I feel tired. I feel, a little brain dead, but I'm not emotionally wrung out.
Yeah. And we're seeing this year, really, normally this is the time of year, the first week or two, it's what we call tire kickers.
Yeah, we've got a few of those, and that's fine.
We've had very few of those.
Well, what tire kickers are people trying to figure out what they're going to do for the following year.
Yeah.
I had one coming in that they're getting ready to retire next summer, and they tire kicked, but their timing was good. It was a weekend day.
So yeah, there was a certain amount of actual shopping versus selecting plans. This year we've seen a lot of first timers.
Yeah, which is really interesting.
It's really reminiscent of those first couple enrollment seasons that have heard word of mouth, so it feels very different for enrollment.
It does. We had several of the people in the last couple of days were folks we'd scheduled appointments with over the course of 2022 who somehow at some point decided, oh my gosh, I guess I should have some health insurance, but they didn't have a qualifying event. So it's like, okay, well, let's schedule. We'll get you going for 2023. And they're showing up. In the past, that particular population would often just say, oh, never mind.
Yeah.
That's not happening here.
Yeah, we've had very few people not show.
Yeah, not a couple, but that's just gives me a break to do just catch up paperwork.
Yeah, and it's one of those ones. It's consideration because if you say, hey, you know what, I can't make this, awesome, boom, we cancel the appointment. Someone else can slide in there,
which has happened
and
regularly.
we can reschedule,
and we will reschedule you, yes, if you want it.
I've had so far. There's a couple of those I've seen that have been rescheduled. That particular time slot that's on the fourth customer in there.
Yeah, it's just I saw that. It's like, dude.
Yeah. So when I say it's very important, it's like, hey, if you can make that schedule, great. If you can't, let us know immediately.
Yeah.
Someone else will take it.
Someone else will absolutely take it.
And the more time that you present that opportunity, awesome.
It's very kind of you and considerate to do that. Don't just not show up, please.
Yeah, don't be a no call, no show.
Yeah, that doesn't make me happy.
Yeah, in previous years we've had people that have done that, and after the second one of the no call, no shows,
we have a rule.
We have a rule as you're not allowed to schedule anymore. You gotta walk in our office.
You gotta walk in and pray for help. Or there's a spot we can squeeze you in somewhere.
Yeah, because
usually you have to talk to Matt because I'm with somebody else.
Yeah, I'm the overflow, and if it's a Medicare.
Oh my God, is that November already? Where do the weekends go? Oh, that's never mind. I know what that is.
Yeah, Susie's kind of getting a little bit terrified.
Well,
if she really wants to see it, because I didn't schedule the Lost Apple Health there.
Oh yeah, what are you looking at? He's looking at our schedule. Yeah, go ahead and do it. Yeah, I know. I knew that though. I knew that. Yeah. I knew that.
There's no Medicare slots until the 19th.
Yeah. Well, yeah.
If you need something emergency,
let me know.
Let us know.
We're not completely.
We've been tucking people in on like 10 a.m.s on Saturdays.
Yeah, we've got a 5 p.m. Is that today? Or is it next week? It's the weekend. It's the weekend. Yeah,
Saturday,
a long Saturday. Yeah.
Yeah, our next half-hour appointment that we got available is on Saturday the 12th.
Yep, and we'll make it work. I mean,
it's one.
There's one of them. There's more spots available. We've got into December. There's a lot more spots available in December.
Okay, for Medicare, we've got till December 7th.
Yes, and for individual, December 15th if you want a January 1st start date. If you want a February 1st start date, we've got until January 15th. Don't normally recommend the Februaries. Yeah,
now we are, like I said, we are burning through, close to 20 appointments a day, which is a pretty good.
It's a good clip.
It's a good clip for in person. And our current appointments, we are at 228.
Yeah, it went down one.
Actually, we left last night and we're at 225, so it's gained 3 overnight. Oh,
because we were 229 about this time yesterday.
Yeah, so we are holding strong. We are booked out in a week's advance. I'm busting out the card table and make it official. probably by the end of this week.
Mm-hmm.
If you need an appointment, there's plenty of spaces up in Quincy. Because we do got our partner up in Quincy that is up, and it is one of those things. I also do the walk-ins.
Yeah.
And that is the thing, is we've had a tremendous amount of word of mouth, and it's because we want to break down and explain the plans to the best of abilities and how you can use them.
We want to make sure you understand what you're getting.
Oh yeah.
There's no way I want you to walk out here going, I have no idea what I just did. That is against everything I stand for.
And it's been that way for one of the things is we have is a conversation on the difference of what we do versus open enrollment at a job.
Oh,
work plan.
If you have a work plan, basically they hand you a packet and say pick one. If you don't pick one, it'll roll over to what you have. It'll roll over to this one.
Yeah, and you've got 2 weeks to do it.
If you're lucky.
Yeah. You might have like four plan selections. And they don't. It's like, what's this HRA thing, or what's?
And they never explain it.
And then, no, they're not trained to.
No, well, no one's trained to. There's never any kind of meeting about it. They just say, here's your. If you're lucky, you get a packet. Maybe you'll just get an email.
Yeah, I used to do assembly work, full on production work, even treetop. You'd have this is the annual enrollment period, and they go over here's the form, pick one you like. We need to see the form back in 2 weeks.
Yeah,
and it was really ugly, and that I'm sure, because it's been 16 years since I've worked treetop,
something like that. Yeah,
I'm sure that presentation has gotten worse.
You're assuming there's a presentation?
I'm assuming there's a presentation.
I'm thinking it probably just shows up when you get it probably just shows up in your mailboxes. Like, oh, here.
Well, you don't even have mailboxes.
Well, there's a stack at the front door.
It's the front door. They make the clerk hand them out.
Yeah.
Yeah, and so I imagine that's still brutal. The difference is oh my gosh, you get someone who's trained in the plans, explain them to you. And if you, in the case of a licensed producer or agent or broker or whatever term you want to use, they can recommend a plan.
Yes. If we're licensed, we can recommend a plan, because we can do a needs-based assessment and recommend this one would fit you best.
And this is why.
Because we understand why.
And because you're licensed and trained. Now we go out there and we work specifically in our state. There are some out of the area numbers. That's why I always recommend, if you call someone, make sure they have a local number.
Yep. Now I know that I've spoken to several people this year who got a couple who set up their Medicare with a broker over in Seattle, and that's fine. I have clients in the Seattle area. And Spokane, and all over the state. Unfortunately, the broker they were working with was like, "Oh, here, I think they were pretty much focused on the one plan, and so my clients got kind of jammed, kind of monolined, a little crowbarred into something that maybe wasn't the right fit." Yeah. That's one thing that I do with Medicare is I use all the tools I have to fairly compare all the plans available side by side.
Oh, you use Medicare.gov.
I'll use Medicare.gov, which is what Medicare wants us to do.
Yeah, it's
unbiased.
It's an exchange that you're able to compare plans side by side.
Exactly.
The Healthplanfinder for Washington State is the same thing. You can compare plans side by side
in an unbiased, unvarnished manner. It's just the facts. And then we say, okay, I plug in your medications. Maybe we look for a specific doctor and we find out which one is going to be the most cost effective.
Yeah.
And not every plan contracts with brokers for Medicare drug plans. And I'll say, okay, go to their website or go to Medicare.gov and click the Enroll Now button.
Yeah, because for whatever reason they don't contract out and they want to retain that.
Yeah, and that's fine. That's their prerogative. Yeah, but I am not going to let you out of here without knowing what you've got, even if it's something I'm not going to get paid for.
Yeah, and that's kind of the big difference is
Well, that's one of the differences for us.
Yeah, is we do insurance. We don't do banking.
No, we are not bankers. I was asked yesterday if we did taxes. I said no.
No, and that's a very important distinction. Is we refer out.
Oh yeah.
It's like, hey, no, this is not our expertise. You need to go here. You need to go and work with someone that does wills, or you need to go with someone that does senior planning.
Yeah, financial planning or bookkeeping or accounting or wills or whatever. That's not what we do. We do health insurance. Shayla will be doing property insurance. She'll be running quotes as early as January. And that's what we do. We do insurance.
Yeah, and if someone comes in and says, hey, I want a travel agency, it's like, okay, let's figure that out and get you licensed so you can become an expert. And once you become an expert, it's like, okay, you're our expert. Or if we have someone that says, I want to do real estate with you guys, it's like, okay, are you licensed? Are you expert? If the answer is yes, it's like, okay. We're kind of weird that way. We want experts of the field that we can recommend to.
Partners that we can refer to that have the same level of value and care for their clients that we do.
And that is very important to seek out and have experts in your life.
Yep. Bring in the experts around you. I've said it before. I know I have a transmission in my car. I know transmissions can fail. I don't know how to replace a transmission, but I have people around me that do.
Yes.
And that's what you need. I will be your transmission expert for your insurance, as it were. Yeah, that came out a little weird.
and that's the important thing is you got to use them on a regular basis.
Yeah.
Or they go away. And it's just the fact, people's got to eat.
That's true. And support your local people eaters.
People eaters.
That came out wrong. I have got to get. I got to get more coffee in me.
You got to get more coffee. Yes, Susie's going to be on double coffee day. So yeah, here's the thing: if you don't have a job plan, this is the time to shop. There are a lot of deals out there. From experts' opinion, between 40 to 60% that don't have, that go bankrupt is one of the things that show up on there is medical bills.
That's right. And every health insurance plan on the Washington State Exchange and on Healthcare.gov across the United States with the ACA has an out-of-pocket maximum.
Yep.
The most that you can be charged in a calendar year for all of your medical services. In the event you get bit by a shark, you're not going to go bankrupt. You might have a pretty good sized bill, but it's going to be a fraction of what you would pay if you spent 10 days in the hospital treating a shark bite.
Yes. So, a little bit of planning now goes a long way.
It does.
If you don't have an appointment to work with someone, set an appointment to work with someone.
Absolutely.
And you can plan your life and you go out and do your other things, and then it's like, oh yeah, it's appointment time.
And we'll send you a reminder if it's us.
If it's us, yeah, we are very notorious for sending all sorts of reminders.
Almost to the point of annoying.
Yeah, well, it can be a little bit annoying for some people. So others, it's a godsend.
Oh yeah, I've had a lot of people say thank you.
So yeah, there are ways to make your life a whole lot easier because a little bit of planning now can save you if you fall off the back porch and break your arm and $7,000 to get that arm reset.
We talked to someone not that long ago. One trip to the emergency room cost him $11,000.
Yep, and we see this on a regular basis. And right now we are working as hard as we can to bring as many people as we can, because the magic number this year for Washington State is if you make 250% poverty or less, which is about $32,000. You can qualify for Cascade Care Savings, which means a zero-cost silver plan and a large percentage of a gold plan paid off.
Exactly.
For the premiums.
Yeah. I mean, I did a $1,000 gold plan for $83 because of those credits.
So there are massive deals. There is no real excuse to be walking around, I'm not insured. Because even if especially if you're broke as a joke,
there's really no reason.
There are plans available. If your work doesn't offer one,
There's plans available.
There's plans available.
If you are tired of your job and want to go start your own business, there's plans available. You can quit.
If your job lets you go, there's plans available.
If you're hanging on to your job because the only reason you have it is because of your health insurance,
there's plans
available.
And here's the goofy thing that you should take away from all this. There are people out there that can help you.
Yep. That's your main takeaway.
You don't have to understand everything. Mm-hmm. You just have to understand that you can find people that help you.
Yes.
You know, I know we're like on the Young Invincibles, Out to Enroll, the 211 project. Mm-hmm. We're on the Healthplanfinder itself. If you look for enrollment centers,
just Google us. We pop right up.
Yeah, there are the folks that are in this to help as many people as they can, or make themselves available and make themselves visible.
Absolutely.
It's the ones that you got to do they're throwing up a card table in a back room somewhere. And it's like, okay, that's the point where you should really check their credentials.
There you go.
Hey, have a great day.
Enjoy your Thursday. Thanks for joining us on Suzilla.
Enjoy your Thursday. If you haven't set an appointment, set an appointment. I can't stress that enough. Set an appointment.
He's stressed enough. He's gone hoarse.
Yes. Lock in those plans. And 2023 is going to be a great year.
Yes, it is. It's a year of the rabbit.
Sure. Okay. Bye.
It is.